Brian Calasar mentioned a few minutes ago that this is an anniversary of COVID, the declaration of the global pandemic, the sixth anniversary of the official start of the COVID pandemic. But you'll remember that for several months ahead of that, we have been hearing with growing alarm about the spreading of the virus. You will also probably remember about how it absolutely raced through long-term care homes here in Quebec. Many of those vulnerable residents ended up dying, some of them in horrible conditions. We remember what happened, for example, at that care home in Dorval, where the staff fell ill or left their posts, and the residents were basically left on their own and became dehydrated. And it was a terrible situation. And after that, a lot of talk about improving long-term care, improving resilience of the network. Here to tell us whether any of that has been accomplished is Anthony Pizzino. He is CEO of the National Association of Federal Retirees. Anthony, welcome to CJAD 800.
Thank you very much.
In a nutshell, is it any better now anywhere in Canada, do you think, Anthony?
I'm afraid it's not. I think there were gaps that were identified during the pandemic, during COVID-19 pandemic, that quite haven't been fixed yet, in terms of ensuring that there's protection for residents of facilities, but also for the staff. So overall, I guess the answer to your question would be no.
That's very distressing, given the death toll, particularly here in Quebec. What has not been done?
I think one of the things that you can look at is not only what hasn't been done since COVID, but also what hasn't been done since the previous epidemic, which was SARS. And there were some really good outcomes from that report by Chief Justice Archie Campbell that could have been applied to COVID, and those were ensuring that there was facilities to isolate individuals who became sick, to ensure that there was enough personal protective equipment, current personal protective equipment for the staff, and for residents and for visitors, training. All of those things, I'm afraid, are not in place. It's like we have forgotten not only the lessons from SARS and also from COVID, but we're failing to recognize, I think, the most important part of what happened during the pandemic, and that is the deaths of a large number of residents and staff of those facilities.
It particularly irks me that the PPE system has not been addressed. This was one of the big conclusions that came out of the pandemic, I think, in Quebec long-term care homes, the fact that employees had nothing to protect themselves with. Here at my workplace, we still have boxes of masks all over the place. So why is this not the case in long-term care homes? Why are they ill-prepared?
I think that's a really good question, and it's certainly a question if I had a family member in a long-term care facility, would be one of the questions that I would ask is, do you have enough personal protective equipment on hand? Masks is a good example, and most importantly, are they expired? Are they still current? Do you have a system to replenish those? Those are the sorts of things that need attention. And if we forget the lessons of the individuals who passed away, what exactly are we doing here to care for our most vulnerable part of the population, which is an older population?
At the time of the pandemic, especially after the deaths started at the long-term care homes here in Quebec, we started talking about standards, whether there should be, for example, a Canada-wide standard for long-term care. That seemed to go nowhere. Is there any hope of any discussion whatsoever?
That's a really good question. And, there is actually a blueprint for a national long-term care standard. And it has existed since 2023, but legislators haven't made it a priority to implement that long-term care standard. And that standard applies to everything within long-term cares, including health and safety requirements and safety requirements for residents, visitors, and workers.
If you were to set the priorities for what should be tackled first, because we've touched on a couple of them, the PPE for the staff and the preparation or having ready isolation areas for people who do fall ill. What needs to be the priority to your mind, Anthony?
I would start with a standard. It is probably the most nonpartisan issue that you can talk about, taking care of individuals that are in long-term care facilities and make sure that standard is implemented, that it's enforced. Have conversations between the federal government and the provinces about how you're going to implement and enforce those national long-term care standards. That would be the starting point to, I think, many, many improvements that could be made in what are people's homes. This is where they've gone to age, if that's their choice. So those long-term care standards would be the priority that I would say would be the starting point for the conversation.
We know that anytime we start talking about federal standards, there's a pushback politically in Quebec, which says, no, Ottawa is trying to centralize power. No, we're not going to, we set our own standards and basically put the stick in the spokes of the bike wheel. Would you not anticipate that happening with this as well?
Absolutely, and that's one of the reasons why we're not making progress. The standard is a blueprint. The ways that provinces can implement those standards to live up to that standard is up to the provinces. They have control over that. So it's not a matter of, one jurisdiction telling another what to do. It's that the government has created a standard that applies across the country. How are provinces going to implement those standards to make sure that there's equity in terms of performance, in terms of taking care of residents, of taking care of staff, of taking care of visitors and family members? That's the important part. It's not the push and pull. I said earlier, it's a nonpartisan issue. It should be a nonpartisan issue.
Yeah, it should be. I think that's the key. It should be. Anthony, thanks for your time.
Thank you so much.
Canadian women are looking for more out of themselves, their businesses, their elected leaders, and the world around them.
And that's why we're thrilled to introduce the Honest Talk podcast.
I'm Jennifer Stewart.
And I'm Catherine Clark. And in this podcast, we interview Canada's most inspiring women.
Entrepreneurs, artists, athletes, politicians, and newsmakers, all at different stages of their journey.
So if you're looking to connect, then we hope you'll join us.
Listen to the Honest Talk podcast on iHeartRadio or wherever you listen to your podcasts.